Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to talk about answering the question of, I need a hip replacement, I need a knee replacement, which should I have done first? Hi everyone, so today we're answering the question of, you are an individual, you have pain, you have arthritis in your hip, and you also have pain and arthritis in your knee joint. And the question is, which replacement, which surgery should I have performed first? Well, obviously it depends on which side it's on. But let's say, so for the first thing, let's say that you have hip pain and you have knee pain on the same side, the same leg, and you need replacement on both, or you've been told you need a joint replacement for both of them. Which should you have done first? And the answer is, for the vast majority of cases, not necessarily for everyone, but for the vast majority of cases, you want to have the hip replacement done first. And the reason for this is that pain can be referred. And what that means is, for example, if you have pain in your low back, this is probably the most common, pain in the low back kind of causes this pain, this referred pain or this radicular pain, we call it nerve pain, sciatica, that can go down into your leg. It can go into your hip, into your thigh, into your knee, all the way down to your foot and ankle. So a lot of times when you have referred pain, so pain that's originating from somewhere else and then moving to other parts of the body, a lot of times, but not always, a lot of times it goes from proximal to distal. So it goes from the low back to down the leg, or it goes from the hip to the knee joint. Not as often, not as common that it's going to come, you're going to have a cause, something going on in the knee joint, and it's going to refer pain up to the hip. It's more likely and more common to have hip pain and groin pain, and that's going to radiate and refer pain down into the knee or toward the knee. So having a hip replacement surgery and going through the rehab, going through the recovery may very well allow that knee pain that you have to clear up, or at least be not as significant, not as severe. And then at that point, obviously, you're going to have to reconsider what your options are and what you want to do to manage this. So my recommendation always is, if you have someone says, or the doctor says, or you think that you need a hip replacement and a knee replacement, have the hip replacement first. Go through the rehab, go through the recovery. Not as strenuous as the recovery overall for most people. And see if that alleviates or impacts what you're experiencing down at the knee. If it improves significantly enough, maybe you don't necessarily need knee replacement surgery, or you can delay it for a prolonged period of time. If you have hip pain on one side of the body and knee pain on the other side of the body, then it gets a little more complicated, a little more nuanced. It's really going to come down to the individual, what exactly is going on. Things like, how long have you had the knee pain or hip pain? How debilitating is it? A lot of times the one that feels worse, the one that causes more pain, the one that causes more discomfort, the one that is more limiting, that's the one you want to get done first, because you have to remember that you're going to have to go through rehab, recovery, physical therapy, exercises, activities, walking, all sorts of things as you recover. So you want to be able to tolerate that. So if you're probably going to be able to better tolerate that with the joint that is causing you less discomfort, putting a little bit more stress to that joint that's causing less discomfort than the one that is really aggravating and causing things. So the short answer to that one is, if the joints are on different legs, so one hip on one side and the knee on the other side, pick whichever one is really causing more debility, more problems, more pain, more discomfort. Get that one done first, because you'll better be able to tolerate the rehab and recovery afterwards. You don't want to go through rehab and recovery through a really When you have another joint that's really painful and really uncomfortable, it's going to be tough to tolerate that already. So might as well pick the one that you're able to tolerate it at least a little bit more. So hopefully that is clarified. I didn't ramble too much on that point. So if the knee and the hip pain are on the same joint, get the hip replacement first. If they're on opposite sides, do whichever one is causing you the most pain and discomfort and problems. Thank you very much for watching, everyone, and take care.